Well, in my definition, a mini facelift would be something that's either a better style of thread lift or a surgical lift that just lifts and tightens the skin only. But the problem, though, is that these definitions are by no means standard, and what a mini lift might mean to one person is very different to what a mini lift might mean to another person. See, there's another term that people often talk about. It's called an S-lift. Now, there is actually a thing called an S-lift that's described in the textbooks and described in the journal, and it's a certain style of lift. But see, out in the real world, there are many different operators who use that terminology differently, and so their result is going to be a little bit different as well. The other confusing term is a full facelift. Well, what's a full facelift? And again, there's no set definition for that. Where it's most important is that you actually have to sit down in front of the doctor and say, well, what is it are we going to do? Yes, we're going to do a facelift, but how is your facelift going to work for you? And how might it differ from somebody else's facelift? Because after all, we're all starting from a different position. Our genetics are all different, our way we respond to things are different, our facial structure is different, so you can't do the same lift on everybody and expect to get the same result. The other issue that's very important is that people are very fearful of having this overdone look, this sort of windswept type look in a so-called full facelift. Now, whether it's a full facelift or some other sort of facelift, if you get the windswept look, it's because the person's been trying to do too much. They've been trying to achieve more than you can reasonably do. And the techniques are just too extreme. Now, I'm a bit cheeky, and I call that sort of look the Hollywood facelift. If you want a Hollywood facelift with that windblown type look, well, you go to Hollywood, don't come here. The thing is that what you've got to do is have your patient looking and feeling natural. You don't want people to come up and say to you, oh, you've had a facelift, I can see this and I can see that. You want people to look at you and say, geez, you're looking well. Have you had a holiday? What's changed? And that's a good facelift. The other important element too is that a facelift in this modern times is not just a surgical procedure. Facelift will redress things like sagging and gravity effects, but it doesn't address issues like texture or complexion, and it doesn't always fix volume-related issues. So when you do a facelift, in my practice at least, you do what you can and what you need to do surgically to tighten things, but then you might add in some skin care, you might add in some laser treatments to improve the texture and complexion of the skin, but you might also be needing some fillers to get the curves right and the contours correct. So really, a modern day facelift relies a little less on pure surgery, but it encompasses different modalities. That combination is going to give you far, far better result, and it's going to give you a natural looking result.